But smoking is also a major cause of heart disease and blood pressure problems. Nearly 30% of all coronary heart disease deaths in the United States each year are attributable to smoking. Smoking doubles the risk of heart attack and stroke. A person's risk of heart attack greatly increases with the number of cigarettes he or she smokes. Smoking damages the arteries of the heart and brain, resulting in heart attack and stroke. A single cigarette can impair circulation for up to 45 minutes by constricting the small blood vessel, in addition to decreasing the blood oxygen supply. Also, smoking increases the risk of abdominal aortic aneurysm, which is a dilation of major vessels supplying the blood to your abdominal organs and lower extremities, resulting in circulation problems there. Smoking cessation leads to decrease in the risk of cardiovascular associated mortality. People who have had a heart attack can experience as much as a 50% reduction in the risk of another heart attack and cardiac death. Cigarette smoking leads tar and other substances from a person's mouth to the lungs and then to the alveoli. In the alveoli, by gas exchange, the harmful products enter the bloodstream. They then reach the coronary vessels, which are the blood vessels supplying the heart. These toxins from cigarette smoking lead to inflammation, thrombosis, and fat deposits in your heart vessel. This plaque in turn decreases the flow of blood supply to your heart muscle. This leads to heart attack and even death. Patients who are experiencing the symptoms of a heart attack complain of a pressure-like chest pain behind the sternum, radiating to the left arm, accompanied by shortness of breath. This is a life-threatening emergency and can be prevented by not smoking. Stroke is one of the leading causes of death. It affects more than 700,000 people each year in the United States. The risk of stroke is more than double among smokers. The harmful substances in cigarettes can make their way through the arteries into the vessels in the brain, causing a buildup of fatty plaque in the brain vessels, which can block the flow of blood to the brain tissues, resulting in damage to the brain leading to stroke. In addition, smoking also decreases the amount of oxygen in the blood, making the heart pump faster, which creates some turbulence and increases the chances of forming clots that can dislodge and go to the brain vessel, leading to stroke. The good thing is that this can all be prevented if we quit smoking or don't smoke. One in 20 Americans over the age of 50 has peripheral artery disease, or PAD. The annual economic cost of peripheral artery disease is 164 to $290 billion. PAD develops when your arteries are clogged with plaque, which are fatty deposits that in turn decrease the blood flow to the extremities, leading to pain and cramping during walking, and ultimately loss of blood supply to the extremities that may result in a need to amputate your legs. Smoking increases the risk of PAD several fold. It also increases the risk of aortic aneurysm, which is bulging out of aorta, which is a big artery that carries blood from the heart and distributes it to the rest of the body. Aortic aneurysm, if not treated surgically, can lead to death. 75% of women who develop aortic aneurysm have smoked at some point in their life. Smoking can cause inflammation, damage, and stiffening of the artery wall, making the flow of blood more turbulent. Smoking can increase the chances of forming blood clots by making the blood thicker. Nicotine in smoking increases your blood pressure. In addition to PAD, smoking also causes a specific disease called Buerger's disease, a rare disease that causes acute inflammation and clotting of the arteries and veins in the hands and feet, and can lead to loss of the hands and feet. It occurs in individuals between the ages of 20 and 40 years old who are heavy smokers. Each cigarette reduces your life by 7 minutes. Tobacco smoke contains more than 4,000 harmful chemicals and more than 70 different cancer-causing substances. When a person smokes a cigarette, these harmful chemicals enter your lungs and through circulation spreads to the rest of your body. Research has shown that these chemicals damage your DNA and cause changes in your cell genome, making your cells multiply and grow out of control. The healthcare cost of cancer in the US
Alaikum.
is more than $200 billion a year. Smoking increases the